Nakulwairo waliwo yagambye mu Kampala Ebola yatuuseeyo naye kati ffe twagala leero tukyogereko gwali ekati kyomanyi ku Ebola, where is it coming from, how did it come, and I've just established that Ebola has 5 strains. Kati Ebola ze this time bagita Sudan strain, waliyo Cote d'Ivoire, waliyo Zaire, waliyo Reston, waliyo ne bundi bujjo strain ya Ebola.
Strain kitegeeza different
parts. Say era nja kutandikira osobola kumanyi omuntu eyali afudde Ebola kuomanyi ba relative.
Kale mbawulira bulizi ku radio yenga bade sinda relative nano.
Yes sir.
Yenga tumbala ku TV radio went.
Nyabogwe, what do you know about Ebola?
I know that Ebola is a killer disease. It's a very dangerous disease. I've never lost a relative to it, but what hurt me most one time was when this Dr. Lupia died.
Yes.
And then there was another doctor in, I think, was it Western Uganda? It really touched me and moved me so much.
Right.
Yes.
When you look at the sacrifices of people like Dr. Lupia, about government, health workers, abantu abakola ku balwadde, ale tebalina medical, tebalina protection, tebalina goggles, tebalina that all that stuff.
But then the law says they still have to look after the patients.
Of course, we'll dedicate a few minutes to Dr. Lupia from Nacho Hospital at Tunabakumaliza. Sebogwe chichomanyi ku Ebola.
Nze manyi nti Ebola it's a killer disease naye yali badde yeetaaga serious government attention kubanga kiba kyennyamiza bw'ogenda mu malwaliro ne bagamba nti tewaliyo gloves, tewaliyo bikozesebwa ku ba doctor naye ng'ate ba doctor like Dr. Lupia madamu gwayogeddeko ya sacrificing n'agamba leka anyimirire kwegamba ne twesanga nga afuse hero oweye ndwadde naye nga government teri mu kufaayo ku deliveringa byetaagisa mu bwangu kulaba nti etangira abalwanyisa Ebola okugenda ku bantu abalala kiba kyenyamiza eri eggwanga. So nali badde nsaba nti nga bwamanyiddwa nti yendwadde etejjanjabika bweba ekutta omuntu kyali badde kirungi nnyo gavumenti eveeyo mu bwangu nga president bwe yakyogeddeko erabe nti eteekawo any possible means okulaba nti Ebola nazizibwa.
Kati mukatono komanyiko omuntu alina Ebola omula aba alina signs ki azini otegeera otya nti ono ayinza okuba nga alina Ebola?
Abeera ne red eyes, diarrhea, stomachache, abeera n'olusujjasujja.
Well, twafunye omukisa ntwogera ne Dr. Asuman Lukwago, who is the permanent secretary at the Ministry of Health. Uno katuli about Ebola. When we come back, we'll look at the particular symptoms, but also now look at how you can prevent the contact, especially in a place like Kampala.
Over here where I'm a conductor, and I'm saying, muyingire we bali kuje omdabiye.
Tugonga oba tetukyabonga.
We have confirmed the Ebola outbreak in our country, and this confirmation was announced to the country on 28th. And our status is that we have a cumulative number of people who have been found with Ebola to be around 38 people, and around 16 people have died, and then 3 cases were confirmed. The problem for this Ebola outbreak, many of the cases didn't present like the typical Ebola, and Ebola is among the diseases which we refer to as hemorrhagic. But because it is a fever, someone has to get high temperature within a short time. You are walking, all of a sudden you get severe headache, high fever, and red eyes. Sometimes you may also get some rash like measles over your skin, and within a short time, like 1 day or 2 days, you start to bleed. And bleeding is from many parts of the body which are not common. So you bleed from the nose, you may bleed from the gums, you bleed from the eyes which are red. So far, we have about 38 cases who are suspected. We have confirmed about 5. We have lost about 3 out of the confirmed cases. We have lost cumulatively 16 cases, because we are adding even the cases which died before we discovered that it was Ebola. And then we are following up about 176 contact cases. Ebola usually is transmitted from wild animals. It can be transmitted from dead bats or bats when they are flying. It can be transmitted from pigs, wild pigs. So we are advising the community not to engage in true hunting, game hunting at this time, because we don't know the reservoir really. We have created isolation centers for those who are sick with symptoms. And then the good thing, we can now diagnose Ebola as fast as possible because our diagnostic capacity is now based at Entebbe. 2, we are mobilizing resources to support those patients because, you know, the identified patients are not treated by their relatives. So we have to feed them, we have to care for them. We have our personal protective equipment, which we have supplied to our health workers, and we have created barrier teams because barrier is another issue again. If you lose a patient who is suspected to be Ebola, don't try to touch those dead bodies and don't even bury. They should just call. We have given them somewhere to text their messages to tell us that here and there we have a patient who is presenting like this. We have given them the toll-free calls, telephone numbers, which are being circulated by our departments in health. Reactions.
Okay, this of one bana batambula ennyo okuli abava abakongo Zaire awo baje nyama gibakola ki gibasanza awo bayinza okubanga yankima oba yabinyira biki ebyo ebimu kukola ki ebyete kundi endwadde yaki ya Ebola yabaganya abantu okulya ennyama yaki yenkima eyebinyira enkima bazirira ddala ekkongo.
Can you tell the difference? Why it's all meat, you just eat?
I think it's all meat because one time I was in Congo at one of our embassies and I was amazed to see one of the secretaries jubilating after seeing a soldier coming in with a dead meat of a monkey. Actually, when I asked her the reason as to why she was jubilating, she said, this is very sweet and I cannot even think of the cow's meat when this one is there. Wow. So I think the best way of how to prevent Ebola to our fellow Ugandans is one, like on the side of the government, we must be having national IDs so as to identify who is a Ugandan and who is a foreigner here. But people are coming in anyhow. Ajalero enchana nadayo, and most of them are pretending to be Ugandanese. This because is one way of...
I find it very confusing. Ebola ja nagenda najja navaawo bulinga musujja abakongo fere tubawulirangako tetukibuze mbadde suganga ko
themselves die of it.
They do.
Our exits zonna ziri open katwafa kyalo kimu ensi yonna yabadde ku maki ekongo leero omusanga busiya tewali control. Uganda oyingiranga bw'oyagala kale ezo zonna embeera zisobola okusaasanya obulwadde obwo.
Gavumenti wawuliranga ekibaali waliyo keesi lwaki tebatwala health center ekibaali neteekayo kubanga waba abazungu bwe batyo bakikola nosalako the whole of Kibaale nogamba anyone in Kibaale you must be tested. Do you think that would make sense?
Nze nsuubira nti ekyo kyandisinzeeko okusinziira ku kubanga omuntu kalinga bagamba nti asibuse Kibaale omulundi guno gavumenti amangu ago yandibadde ezitukiramu negamba nti kati Kibaale yonna tugisazeeko. Omuntu yenna afuluma Kibaale okugenda awalala alina okubanga bamutesitinze nti talina Ebola. Ate nekirala bagamba nti eno Sudan kati distance eriwo okuva Sudan bwabanga oneva Sudan okugenda ekibaale ndabira ddala nga nene nnyo kuva ekibaale okuva Sudan paka ekibaale ate nga at least singa bwe buŋŋamba nti Kibaale Congo awo nandikkirizaamu.
One thing I found very confusing, Nyabo, wano twasoma mawulire nti Ebola suspects are being hunted for ngabaduse tebagala kubajjanjaba. That is very strange. Mbadde njagala kubuuza ekibuuzo kyolowooza lwaki badduka kubanga paka kati neebuuza lwaki togenda n'ofuna okujjanjaba.
They feared
the treatment or to be isolated from other people. Right now we know you feel inferior.
Some information here. Transmission of Ebola is through body contact, secretions, organs, and or any other body fluids of infected persons. It has an incubation period of 21 days. So then after 24 hours osobola okufiirawo. Batugambye nti when it comes to barriers, even the place around mwetuziko omuntu waawo ebera infected. Kati fe abana Uganda bakaba ne tukwata omulambo ne tukola ki? Yes. That's not allowed. And then we also told that you can contact Ebola from soiled clothing or linen from an infected Ebola person. So actually, no jamu engoye zono ziteka. Toll-free numbers to call Ministry of Health 0774 451 762, 0706 506 294 or 0757 174 555. Otherwise, also to Minibuzz Uganda @gmail.com.